there, Dr. Susie Gronski here, pelvic floor physical therapist and sex counselor. And today we're going to unpack a touchy and often uncomfortable subject, testicle pain. But not just any testicle pain, pain that might actually be coming from your lower back, your abdominal muscles, and your brain. When it comes to testicular pain, there's a lot more going on below the surface than most people realize. I often see testicular pain linked to pelvic floor muscle tension, nerve irritation, particularly the pudendal, ilioinguinal, or genitofemoral nerves, which we'll get to later. Mechanical strain from the lumbar spine, or even inguinal hernias. In many cases, it's not the testicle itself that's the problem, but the surrounding muscles and nerves setting off alarm bells, causing a ramp up of bodily protective responses. That said, it's crucial to rule out any red flags, like sudden severe pain, swelling, redness, fever, testicle position, urinary symptoms, or systemic signs like weight loss and night sweats, all of which need immediate medical attention. Persistent testicular pain is often musculoskeletal in nature, but we can't ignore it if the body is waving a bigger flag. Always better to be safe and get it checked out first. Okay, so let's dig into the lower back testicle connection. Your lower back, specifically the lumbar nerves L1, 2, and 3, 1, 2, 3, doesn't just stay in your back. These nerves travel from your spine, weaving through abdominal tissue and making their way into your groin. They detect sensory signals from the scrotum, testicles, and surrounding muscles, sending those messages all the way up to your brain, where everything gets interpreted. Sensation doesn't actually come from your testicle alone. It's part of a complex symphony of signals your brain processes to let you feel and experience what's happening in your body. Wild, right? So when something's irritated anywhere along that path, from your lower back to your scrotum, it can show up as testicle pain. Maybe you've been lifting, twisting, or doing too much too fast. Suddenly, your balls hurt. That sharp, zappy, tugging kind of feeling, it might not be your testicles' fault at all. It might feel like a dull ache in one or both testicles, often more one-sided if it's acute. But it can eventually affect both sides as it sticks around longer. You might feel a pulling sensation into the groin or inner thigh. You might get a sharp or zapping pain that comes and goes, especially during bending, twisting, or lifting. You might experience scrotal sensitivity, or even sex or thrusting doesn't feel safe anymore. Or you might notice a weird tension or heaviness in your lower abdomen, like something's off but hard to pinpoint. If you're experiencing sudden and severe sharp testicular pain coupled with swelling, redness, nausea, and vomiting, go to the ER. It might be testicular torsion, a condition where the testicle twists on itself and cuts off its own blood supply. All right, so now let's nerd out for a sec. The ilioinguinal and genitofemoral nerves, which stem from L1, L2, and sometimes L3 of the lower back, supply the lower abdominal and groin regions. The ilioinguinal nerve and the genital branch of the genitofemoral nerve actually run alongside the spermatocord to supply the skin of the scrotum and the cremaster muscle. The cremaster muscle is a continuation of your internal abdominal oblique muscle, which stabilizes, flexes, and rotates your trunk. So if you strain or overload these muscles, they can irritate the nerves running through these tissues. There's also another important connection to mention, the posterior scrotal nerves, which come from the pudendal nerve roots, as you can see on the inside. the sacral spine S1, 2, 3, and 4. These nerves supply the backside of the scrotum and are part of the broader pelvic floor nerve network. So irritation or tension anywhere from the lower lumbar spine, abdominal wall, pelvic floor, or sacral region can all contribute to gnawing, aching, sometimes zappy feeling in the family jewels. And who doesn't feel stressed when their balls hurt? Understandably, most guys panic and go to the doctor. They're often told it's Eepididymitis, an infection of the structure on top of the testicle. But in many cases, there's no fever, no swelling, no abnormal labs, just pain. And yet, you're prescribed antibiotics. Maybe you feel better because you're resting and doing something to help with the situation. But a few months later, the pain comes back. You go back to the doctor, another round of antibiotics. This time, they don't do squat. Sound familiar? That's because pain is protective, not always a sign of damage. It promotes healing short term, but when pain sticks around too long, 3 months, 6 months, 12 months, it becomes overprotective and actually prevents recovery. Tissues heal within 6 to 8 weeks. If pain persists beyond 3 to 6 months, the issue may no longer be the tissues, it might be your nervous system stuck in high alert, trying to protect you from what it thinks is a threat. And the longer that protection system stays active, the better it gets at being overprotective. That protection involves everything: muscles, nerves, immune cells, hormones, and even your emotions. The longer this cycle continues without the right support, the more sensitive everything becomes. Even slight movements or touch start to trigger alarm bells. You stop moving like you used to, out of fear of making it worse or causing more damage. Tissues adapt to become less conditioned and less tolerant to your normal activities, and the cycle continues. But here's the good news. This is totally workable thanks to bioplasticity. This is similar to neuroplasticity, the idea that our brains can adapt and change throughout our life. Bioplasticity, a term coined by brilliant pain neuroscientists Lorimer Moseley and David Butler, means our whole body has the ability to adapt and change in response to our experiences, environment, and learning throughout our lifetime. The goal is to calm that protection system and rebuild safety and trust in your body again through new experiences. That starts with understanding what's going on, then moving in ways that feel good, but also gently and gradually challenging you. We'll refine your movement, gradually reintroducing load, and find that sweet spot between comfort and progress. This tells your brain and your body, hey, we're safe now. And yes, that means getting back to the gym, to work, hiking, and to sex. Whatever makes you feel alive, strong, and empowered, without the fear of groin pain zapping you, taking you out of what you love to do. Our protective systems are incredibly complex and sometimes a little too enthusiastic. But with the right tools, education, and support, they can learn to chill. If you've been stuck in the loop, testicle pain, antibiotics, rest, repeat, your nerves, muscles, and brain might just be the missing link. And it's absolutely something we can work through together. YouTube's the preview. Patreon's the party. Tutorials, demos, community, and one-on-one time with me, Dr. Susie G. See you there.